From the mind to the eye, designing and 3D printing novel glaucoma drainage devices. Dr. John Davis AKKARA, Dr. Narayan Balakrishnan, and Dr. Anju Kuryak.
No financial interest. Dr. John Davis and I are practicing glaucoma consultants, make an innovative glaucoma drainage device to practice implantation of this device and help in future implantation of glaucoma drainage devices in everyday practice. The implantation of these glaucoma drainage devices and require a long learning curve. Attempted to make an interesting glaucoma drainage device which has been 3D printed and hence has been used in animal eyes.
3D computer aided design and 3D printing to design and print the glaucoma valves that we are talking about. To our 3D printing lab in campus and use the resin 3D printer to print the model. A tube from a Venflon, an 18 gauge Venflon, to make the tube of the valve is inserted into the anterior chamber or past
and did a conjunctival peritomy to insert the valve. The footplate of the valve is carefully inserted under the conjunctiva. Make sure that the conjunctival opening is big enough to accommodate the footplate. The footplate has a larger surface area than the cornea. The tube is left pointing upwards towards the cornea. The footplate is then anchored to the sclera by suturing through the 4 holes using vicryl sutures. The tube is then measured and trimmed with the scissors. The scissors are kept at an angle so that the tube is cut in a bevel shape. Once this is done, the next step would be to implant the tube into the anterior chamber. But for that, first we have to make a track using a needle, partial thickness through the sclera into the anterior chamber in case of phakic eye, and into pars plana in case of a pseudophakic or a phakic eye. So now that partial thickness tunnel has been completed, then next step is to insert the tube into the tunnel so that it reaches the anterior chamber. Once the tube is inside, we have to make sure that it does not touch the endothelium.
That's all for the surgical part of the video. These are some of the other valves that we 3D printed compared to the first valve, which was actually quite big. Let us now look at some of these newer valves in detail.
We basically designed 3 different models of valves of 3 different shapes and sizes. Fluorescein dyed through all the 6 channels in the valve conduit. This is observed under cobalt blue illumination under a surgical microscope. Here we can see the 6 conduits for the fluid to pass through the valve, and if you lift it up, you can see the external hole into which the tube is inserted. And bottom view, this has a raised area on the top through which the tube is inserted, and it has multiple channels which channel the liquid into the bottom. The plate itself has multiple holes to allow easy fluid pass through into the subconjunctival space. The fluid flow is as seen in this video. Hope this innovation with 3D printing inspires young surgeons to start doing glaucoma valve surgeries and also to design newer models of glaucoma drainage devices.
Thank you, Dr. John. Actually, it's an interesting concept that you have made, but I have few things. See, 3D designing and 3D printing is obviously a good technique for innovations because the cost is all on the CAD. You know, you just are doing it on the computer. So modeling is not necessary and you can just do it on your own. And after you design, you obviously do a manufacturing.
Yes, sir.
Now, there are few things which are little worrying to me. One is, we know any valve implant, it is when it is patented. So you have to measure at what IOP the valve is active.
Yes, sir.
So in this, how did you measure? Number one. Second, if you are printing through 3D mechanism, whatever stereolithotype or whatever design you are making, the finish is usually not good. So that might induce excessive fibrosis. Okay, that is my second concern. Please address.
Yes, sir. So, firstly, this design was mainly made for the wet lab and also to innovate on new design. So, if you have an idea for a valve, you look at say RD or you look at AGV and you say, okay, this is not an ideal design. You have some other idea. You can try out different designs, and as you said, there is practically no cost involved other than your time and energy to design the things in CAD and to print it. It is surprisingly very inexpensive. The 3D printer itself is only 17,000 rupees, and if you look at the cost of material for a valve like this, it will hardly be 50 rupees because only that much material is used. So you make 50 different designs, you get only 50 into 50. So it's not very expensive to as an innovator to make new designs. As about the human implantation of this, right now this material is also not biocompatible, as well as the finish is not smooth. But you can use polyethylene glycol diacrylate or polyethylene glycol 40, and these materials are biocompatible. Once they are 3D printed, they would need to be tumble polished. You might have seen in Orolab or Apasami labs where they tumble polish the IOLs. That has to be done. So once that is done, you get smooth surfaces and they can potentially be implanted. But you need not do all that. You can actually find a design that works and then give the same design
John,
to the
thank you.
company
I
to
think
finalize.